Flex your business with an American Express Business Gold Card. You'll earn 4 times membership rewards points on your top 2 eligible spending categories, like transit and electronics, each month, on up to $150K in combined purchases per year. Plus, you can now earn 3 times membership rewards points on flights and prepaid hotels booked on AmexTravel.com. Terms and points cap apply. Learn more at americanexpress.com/business-gold. Amex Business Gold, built for business by American Express.
Welcome to Raising Me. I'm Adrienne Stein, a mom of 3, a longtime journalist, and trying to figure it all out too. So, you think your kid might need braces, huh? Or a palate expander or aligners, whatever it might be. Today, we are diving into what we should know about orthodontics for our kids. Whether you've noticed your kids' teeth are maybe a little crooked, or your dentist mentioned it might be time for a consultation, which recently happened. For my 6-year-old, which I was like, what? This episode is for you. And a quick shout out before we get started to our sponsor, Maine Health. Today, we are talking with Dr. Meg Dombrowski, also known as Dr. Meg, who walks us through all the ins and outs of orthodontic care, from when to start thinking about it, which again, I was surprised at how young that might be, to the different treatment options available, and even how to manage costs and ease our kids' fears around it. And getting braces isn't just about straight teeth. There is a lot more to it, especially today, including overall confidence. So, whether you're a parent in full-on research mode or you're really just curious about what lies ahead, we have got you covered. Check it out. Dr. Meg, it is so great to have you with us. I'm super pumped about this.
I'm so glad to be back. It's so fun. Yeah.
And I'm pumped about it because I have one who's already been through it, one who's currently in it, and another who I know, just looking at his teeth, we're going to be good friends.
For sure.
But, what is it about orthodontics that it really drew you in? Why do you feel passionate about this topic?
Oh my gosh, I could probably take up this whole podcast just talking about why I love my job. Really, for me, what it came down to is I love being able to connect with families. That's my favorite part of what I do, is all day long, I get to see families and how they interact and their siblings. And that's the best part, is connecting with people. I feel like I come home at the end of my day and I have all these stories, not about teeth and not about orthodontics, but really about, guess what the newest shoe is, or guess what's happening in this school this week, or guess what Spirit Week is in this week. It's just so wonderful to connect with people. And I think that's what's really special about dentistry and orthodontics. In general medicine, you see your doctor maybe once a year, but I get to see these kids every 6 to 8 weeks. I get to see their families. I get to watch them grow. It's just so special. It's really fun. When a kid is, 14 and we finally take their braces off and we saw them when they were 7, I get to show the mom these pictures and our hearts all sort of spontaneously break and also explode with happiness at the same time, because we just get to see this progression through their lives. That's so special.
It's such a rite of passage too. I mean, I actually still remember the day so clearly I got my braces off.
Same. Yep.
It is that moment in time that you'll remember forever.
Yeah, I remember getting everything on and thinking, how am I going to do this? There's so much in my mouth right now. What am I going to do? But it's a rite of passage, and it's also one of those days where I think you look at yourself for the first time as being a little older. Your smile, is now like a big kid smile, and you're confident and you can kind of take on the world a little bit. So it's a really cool day. We try to make it really special in our office as well. And to watch the kiddo flash that smile to their parents for the first time, as you know, because you've had some that go through it. Great. That's like a really special moment. It's a goosebump moment.
I remember it when my daughter came out of the room without her braces, and it was as a mom, my heart dropped because she looked like such a big kid.
I know.
Did you have the headgear and all the things?
I had all the things.
For sure did. Yes.
I had all the things. Honestly, I think that helps connect with my patients sometimes, because I had some pretty aggressive orthodontics as a kid. And so when I have to treat them with something similar, I can really say to them, listen, I went through this too.
Yeah.
And just recognize that it feels like a lot at first, and I sort of tell kids, almost like when you get a new pair of shoes, they feel a little uncomfortable, rubs a little bit weird sometimes. Everything feels bulky and weird. And after a few days, a few weeks, it starts to feel normal. And then, you kind of get used to it.
Yeah, you forget it's there.
Yeah.
Just a little backstory. I had a Herbst appliance.
Oh,
I don't even know if they still do those before then having braces.
Yeah.
Oh, yeah. It was a mouthful.
It is a mouthful. Yeah, I know. It really, there's a lot that can go into it that, kids do have to kind of get used to it. But it's also very cool to watch that experience in kids. A lot of times we have something called, the orthodontic world calls it phase 1, which, a lot of parents will think of as a palate expander or sort of an early intervention type. And then they have a little break and then it's braces when their adult teeth come in. But that sort of early time frame, we're talking like, 7, 8, 9 years old.
So let's pause there.
Okay.
Because when we were talking before this podcast, and I was asking about ages and, what is that magical age to bring kids to an orthodontist, not a dentist, an orthodontist.
That's right.
And our dentist had recommended our 6-year-old. We might want to start thinking about an orthodontics visit. And I was like, I'm sorry, what?
Yeah.
But you're saying that's not necessarily too early. So let's talk about when are the sweet spots to getting kids in?
Yep. So the American Association of Orthodontists is really sort of our guiding leader as orthodontics, which really helps us to kind of talk to parents and give guidance about when kids should come in. And they recommend their first screening appointment at 7. I think it's important too for parents to hear the word screening appointment, right? Because there's 2 things that can happen. You can come in and an orthodontist can say, yeah, I think we're ready for some early intervention. And what that looks like is there's certain things that are best treated in those early stages. So for example, a palate expander is ideally treated between 7 and 11 years old. So that's when we get the most bang for our buck, right? That's when it's most effective and it's most efficient. And it's also when it's the most comfortable for kiddos as well.
And why is that?
So part of it is the way that our growth in our skull develops, right? So the best part about being an orthodontist, I think, is not just the smiles, but also that I get to really look at the growth and development of these kids. And so the top jaw specifically kind of stops growing around 12, 13, 14 years old. Right now, we don't have a diagnostic tool to be able to say, you're done with this growth and you're not done with this growth. So we kind of rely on age. And so that's why it's really nice to say between ages of 7 and 11, because we know palate expansion will work then, because the bones that we're working on are not fused, right? So I sort of tell people it's a lot like, we've all held a little baby before, and when you look at their skulls, you can tell, their skulls aren't fully fused. And one of the last bones to fuse in our whole skull is our palate, which is very cool. But the reason palate expansion shouldn't hurt, and if we do it between those ages, is because those bones, they're not connected yet. There's just cartilage between them. So as we're turning that palate expander in an 8-year-old, many will feel like maybe a little tingle in their nose, but they should feel no pain.
Wow.
And that's really critical to make sure that we're hitting that timing appropriately, mostly for their comfort. And also because if we can get things going that young, then we can really keep a whole host of problems from happening in the future, and crowding, impacted canines, things like that. But that age is so critical because if we miss it, we're in a whole different treatment plan. And so what I tell parents is that screening appointment is really so valuable because you're going to hear either, yeah, we need to get started with something early to make all of our lives easier down the line. Or guess what? You don't need anything. Come back in a year. And sometimes that's also really nice to hear, especially, we have kids that come in and they're a little anxious. So if I just say to them, I'm so glad I got to meet you, come back in a year, that makes everybody feel great, right? So you're just being tracked as they grow. And it just develops that relationship early.
Which eases some anxiety also going down the line. I just, as a parent, it does feel like it's starting earlier and earlier.
I know.
I don't remember the exact age I started. I think it was like around 5th or 6th grade.
Yeah.
And now, again, just that idea that at 7,
I know.
That feels so young.
It does feel
Is
young.
it just advancement in technology, advancement in what we understand about development and teeth and jaw and all the pieces?
That's a great question. I think there's a couple different parts of it. One is absolutely, we know more, right? So we know more now than we knew in the 80s when I was going through orthodontic
Big
treatment.
difference.
Big difference. Mostly from a research perspective. We know a little bit more about human anatomy. We know we have more long-term studies because we're looking at research over the course of lifetimes now. And we have the ability to really track, treatment that happened in the 80s and what happened now, right? Because all of us that had treatment then can kind of be looked at and said, oh, that worked or didn't work. Well, now we know so critically that early intervention, like so many things in medicine, is critical. I'm going to get a little nerdy here.
Okay,
on
we
you. Okay,
don't mind
nerd
nerdy.
part.
Go ahead.
But evolutionarily, our jaws are shrinking in size.
Huh.
It's so fascinating.
What?
I know. If you go to the Smithsonian and you go to the human development part in the Natural History Museum, you can look at all the skulls from around the world, really, and you'll see these jaw bones and these jaws with these huge jaws that have all of their wisdom teeth, fully everything. They have all of their teeth fully erupted. Because when you think back to what early humans were eating, it was raw meats and raw vegetables. And so they had these big skulls with large jaws to be able to chew. And as we've started cooking our food and as we eat more softer foods, our jaws actually really atrophy. Wow. I know, it's not fascinating, but if you look at this human skull over time, you can see those changes. And so, what we look at is, now everybody needs their wisdom teeth out, right? But if you look at those old skulls, they all have their wisdom teeth, which is fascinating. And so over time, our skulls are certainly shrinking, right? And so that's a whole other part of this that is also fascinating.
And that's where a palate expander, in a way, kind of
can help
with that.
Yeah.
So palate expander often is where it all starts right now.
It can. There's also different things like you mentioned herpes, right?
So if this is old, though, this is like a big thing cemented, and I'm sure it's better now, but it was like a big giant thing cemented to the back of my top teeth with a
little piston.
It was like a piston going to the bottom teeth, pushing my jaw forward, also widening it. It was lovely, people. Quite a visual. But right. So that would be another tool.
So,
is that still even
it is,
around?
but I think that some orthodontists still use them. Wow. So the palate expander is one of the tools at our disposal. So the important part about that screening is an orthodontist looking at the kiddo and saying, oh, you could benefit from a palate expander. Or sometimes we have kids that can still benefit from headgear, right? Yeah. Or we have kids that
have that too.
I would call what a herpes is a class 2 corrector. So, and many different orthodontists use different types of class 2 correctors. And, herpes may not be the choice right now.
It's fine. It was a long time ago.
But the reason that all of those are important is because all of those things are growth modifiers. And so that's really what that early stage is helping to sort of modify growth so that we can make things easier in that second round, right? So whether that's bringing that lower jaw forward for a kiddo or making the top jaw bigger with a palate expander, for example, or sometimes it's helping to bring the top jaw forward with, a headgear called a protraction headgear. Those things are all sort of growth modifiers. So when we're young, we can really help that to make a difference later. And I think that age group is also, man, they're so great to work with because they just want to please everybody. Like if you tell an 8-year-old you've got to wear some headgear, they actually will do it. But if you told a 12 or 13-year-old,
big difference.
We've got a big problem.
I've got a 12-year-old at home. I would not want to have that conversation.
Yeah.
But it's so the palate expander. There's often a phase 1 and a phase 2.
Exactly
is what it feels like right now.
Yeah. So I think too, it's funny because my best friend and I were talking about this. I swear she had orthodontics for 6 years when we were growing up.
Same.
Straight. Straight.
Yes.
And that looked like, I remember her in 5th grade, coming into 5th grade with braces and a whole bunch of things on her teeth and me thinking, oh my God, she's so cool. She has all these things on her teeth. And she literally didn't get everything off until I think we were sophomores, not like right before. We're in prom season.
I can relate.
Yeah.
Yes.
So that was sort of, I think, an older model is that we treated early and then through that mixed dentition into the permanent dentition. And now really we have that phase 1 where we do that early intervention And then what's great is there's a little pause.
Mm-hmm.
And then we wait for those adult teeth to come in and, a little bit more growth to happen. And then there's a second phase, typically.
And would that second phase then in theory be shorter? So like your
Yes.
friend and me
Yes.
with
Yes.
braces or
Yes.
appliances on your
Yes.
mouth for many years, you would just maybe have a two
Mhm.
shorter times
Yeah.
versus one long
shorter
time.
and what I would call like maybe easier,
Yeah,
gentler,
okay.
and I think when you look at sort of the history of orthodontics, it's sort of again a nerdy topic, but a lot of us in the 80s had teeth extracted.
Mhm.
And so my friend was one of them. She had 4 adult teeth extracted so that everything would fit in her mouth. And now we really, sometimes that still does need to happen, because there's just a small little mouth and a lot of teeth.
Yeah.
And that's just not possible to make everything fit. But critically now, we're looking, and orthodontists and dentists also are looking at the bigger picture in terms of, airway and our mouths and the structure and our tongue space and the space for our tongue in relation to where it's positioned in our mouths so we're able to breathe better. And so we try really hard not to take out teeth and shrink that, right? We want all the teeth to fit. And we also want everybody to be able to have a really healthy bone structure and gum tissues. So we call it periodontium. And to me, that's the part of this that matters the most, is that we're really trying to make sure that we're affecting their long-term health and growth, not just the short term. So it's not just about, I'm going to make these teeth look pretty. We're really thinking about the whole complex,
Well, I think about speech. You're talking about the
Absolutely.
tongue and
Yes.
teeth and all of that
Yes.
too. So
Yes.
it really is, it's beyond just making
Mhm.
sure teeth are
Correct.
looking good. It really can impact
Correct.
other parts of your mouth.
Yeah, there's a lot of research that's coming out and has been out. Many dentists have actually started to look into this a little bit more as well, especially in our area here, where they're kind of into like sleep dentistry or sleep medicine. I don't know if you've heard about that part of it, but a lot of that comes back to there's some evidence that suggests those of us that had some teeth extracted when we were younger, our arches are smaller and our tongue doesn't have space. So it's actually affecting airway and maybe even some sleep apnea.
Oh, interesting.
It's really interesting. And so as that research starts to evolve and come out, orthodontists are looking at that saying, okay, how can I make sure that I'm not doing this? Like, how can I make sure we're keeping all of these teeth in our mouths? How can we make sure that we are doing the best for each individual case, right? Each individual person. And that's a big part of this whole idea of orthodontics is you could bring in all 3 of your kids and guess what? All 3 are going to probably need something different because they're all growing in a different pattern and they all have different needs, whether it be genetic needs or physical, aesthetic needs and functional
Is there
needs.
ever a time, I mean, and I'm asking this knowing you see adults all the time with braces, but is there ever a time where it's like you kind of have to really readjust what a typical or a traditional treatment would be because kids are, getting their first, and this happened, first orthodontist appointment at 13, 14, 15, and later?
For sure.
Nothing feels better than feeling your best. Which is why Maine Health continues to provide Northern New England with the best network of people, programs, and resources working to help you be your healthiest self. And by doing so, we're creating different paths and giving you options in personal wellness. That's health and care in harmony. That's Maine Health. To learn more, go to mainehealth.org/harmony.
And even adults, there are a lot of times where I say, here's what I wish we could do, but we're maybe not in that world right now. It might not be possible. And so here are our options that we can think about right now. And also here are sort of the risks and benefits associated with that. I kind of tell my patients a lot, my job is truth serum. Like I'm just going to tell you everything I'm seeing. And your job as the patient is to say, yes, I want to do that. Or, is there a way that we can think about, someone might say, I don't want to do that. And I'll say, okay, well, here's another option for us. So I think that's the other part of our job is to really meet the patient where they're at while still trying to achieve, relatively stable goals and aesthetic goals, orthodontists we're a little bit of perfectionists also, which is great. It's very fun unless you ask my husband, then it may not
There's
be
a problem.
super
Sure.
fun to live with a perfectionist. But, that's again, my job is to say to them, here's where we're at. Here's what we can expect clinically out of this if we go with this route or another route.
So back in the day,
Mhm.
it was you had braces all over your teeth,
Mhm.
metal mouth, obviously. I'm sure you've heard that term, but that's not necessarily the case anymore. And so, let's talk about some of the different options or alternatives to braces.
Yeah.
And who might be best suited for what. And what comes to mind for just speaking from my experience with, my son who's currently in the middle of it.
Yeah.
We needed something affixed to his teeth.
Yes.
To make sure that it was happening.
Yeah.
Whereas, other kids, my daughter, for instance, I think could have maybe had something else. So talk to us about the different options and who's best suited for what.
Yeah. So, of course, we have our traditional metal braces. Many orthodontics also carry what we call ceramic or clear braces, and that's an option as well. So that's still a fixed, meaning it's glued on there.
Yeah, right.
They can't
Nothing
take it.
is
Well, they
happening,
can take
right.
them off, but we don't want them to take them off. And those are the options that we would call fixed options. There is also an option called lingual braces, which means it's braces on the inside of your teeth. So when you're smiling, you can't really see them, but they're on the inside. Those work well because they are certainly glued to your teeth, so you don't have to worry about taking them in and out, and they're aesthetic. But they come with some discomfort because, as you can imagine, your tongue is on the inside of your mouth. So if you had braces, it hurts on the cheeks sometimes, and there can be pokey wires. The lingual braces are on the inside. So, but some people prefer that. There is also clear aligners, which most people know of as, Invisalign. Invisalign's probably the most well-known brand of clear aligners, but there are also many other brands of clear aligners that orthodontists might use as well. And so those are a series of, clear plastic retainers, and each one has a little bit of movement in them. So when you switch them out, it very gently moves the teeth towards the ultimate goal. And so that's really getting into the world of what I like to call digital orthodontics, because I treat a lot of Invisalign at my practice, and I treatment plan and painstakingly develop these and these cases over months and months. And then Invisalign, I'm an Invisalign provider, will send me all of the little trays, and we'll give them to the patients, and they wear them at home, right? They're supposed to wear them as close to 24 hours as possible. So to your point, what I like to tell people is they're equal and opposite in responsibility and benefit, because braces, they're on all the time.
Right.
You don't have to worry about them. They're stuck onto your teeth, which is great. But the downside is you have to be careful what you're eating. You really have to be careful not to break them. You also have to be really, really careful to brush around them, because those braces are like little, it's like plaque, love to live around them. And those can cause some permanent stains on your teeth if you're not really good at brushing and flossing. On the flip side, Invisalign's great because you can take it out. So you can eat whatever you want. You can brush and floss normally. The downside is you can take it out.
My vision is it wrapped up in a napkin and thrown into the trash.
Right.
I will just,
and
every kid is different for sure, but that's why we.
So exactly. So we go through a lot of, so Invisalign or clear aligner therapy has come a long way. I mean, if you told me in residency what I could do with clear aligners that I'm doing right now, I probably would have laughed and said that's not possible. But it's really come a long way. So I would say probably 80% of kids and adults can have clear aligners as an option. That being said, there are, of course, things that would preclude them from being able to do that. So in our office, we're having a lot of conversations about you're a candidate for either of these. So now let's have a hard conversation about what's best for you.
Yes.
And I say to everybody, this is a conversation for you and your family, you and your parents to go home and talk about and make sure that you are making the best decision for you. My job is to give you a beautiful smile, and I can do that with both of these modalities. Your job is to decide what's the best thing for me personally. Because we have some kids that they really value their popcorn. And they really want to be able to eat whatever they want to eat. And so they will latch onto that Invisalign and say, I will do this because this is a value to me. And sometimes one of my favorite things is when a parent's like, I don't know if you can do it. And the kid, teenagers are like, yes, I can.
Yeah.
It like emboldens them to prove to their parents that they can handle it. But you're right. There is a wrapped up in a napkin, thrown in the trash can aspect of that. However, I think a big part of that is patient education, right? We really go over with our patients, here's what you need to do. It always needs to be in a case. It goes into your pocket, and they do pretty well for the most part. Fascinatingly, our young male patients actually do better than our young.
What?
I know. I say it all the time. I know.
So I'm sorry. I didn't mean to sound so shocked.
I know. I say we often are shocked in the office. Most of it, I think, this is my anecdotal thought.
And we shouldn't be judgmental.
We shouldn't be, I know. But our male patients between the ages of 12 and 16 really get a bad rap. But with Invisalign, they do very well.
Oh, that's awesome.
I think it's because they have pockets, actually, which sounds funny. But they eat, they put their Invisalign in their pocket, they're done eating, they take their Invisalign out, they blow the lint off, and they literally put it right back in. Whereas our female patients are a little bit more cautious, and when they take them out, they wrap them in a napkin because they don't have pockets. They put them on a table. Next thing they know, they want to go brush everything and clean everything, but they don't have time, so it stays in the napkin. And then someone comes and throws it in the trash can. It's really fascinating. Yeah. It's very fascinating. But overall, they do
seems
pretty
like
well.
a pretty good study you did there.
This is my anecdotal research that I get to do every day. Yeah.
I mean, let's be real too about the cost. And for families who feel like, whoa, this just and maybe because they know how expensive it is, or they just are picturing like this great big expense.
For sure.
What advice do you have for families who are worried about the financial part of this?
Yeah. So I can tell you too, from my perspective, I grew up actually here in Maine, and my dad was a firefighter. My mom was a secretary. And so I grew up in a very average household, and we had everything we needed, but we didn't have a lot of extra things. So they got to choose one kid that got to have orthodontic treatment, and that was me.
Hey.
I know. My brother they were like, he's not responsible enough, so we're not going to choose him. So I've actually had to do braces on him, and he's already lost his retainer. So they were right. But anyway, I certainly know that because I came from a family where really like they had to sort of decide which kiddo was going to get treatment and which weren't. And so I definitely understand that the cost is a lot. It really is. But there's a lot that goes into that cost because it's also really medical appointments throughout a 2-year process. A couple of things to remind patients that I like to tell them is most orthodontists, especially in this area in Maine, that original complimentary visit that we have is usually complimentary. Most orthodontists will do that for free. And it's because it's just a screening appointment. And there usually isn't a cost associated unless, they are recommending treatment to a family. So that's important to know is if you're just trying to find information out and get an idea, most of the orthodontists around here do have a complimentary first exam. And that's a good thing for parents to ask on the phone. Is this first visit complimentary? The other thing that I say is another thing that most orthodontists do here and around the country is they offer in-house payment plans that are interest-free because we understand that we also treat families all the time, right? And so I want these kids to have treatment and I want the families to be able to feel comfortable. And so our office works really closely with the families to find a monthly payment that works for them, over the course of treatment so that they're feeling they can have this treatment in a way that's respectful to their finances as well. So that is another important thing is that to know that there's that interest-free financing option from most offices. The other thing that I like to remind families is your HSA and your FSA can be options for you too. So you can use some pre-tax dollars that you can set aside and use that towards orthodontic treatment. And so we'll have many families that will come in towards the end of the year and say, I'm setting aside my HSA. Do you think we're getting close? And so we'll be able to sort of let them know, I think next year's the year, so that they can start building that to help them, because that's also pre-tax dollars that can really be helpful when you're planning, especially if you have multiple children. It's a big deal. And that's the other thing is most orthodontists, I love treating families. That's what I love to do. And so it's important for us to recognize that we want to help the families individually if we can as well. Because if you have 3 or 4 kids in treatment, we've got to do our best to help you. That's on us to do. So, but you're right, it's a huge cost.
If there was one piece of advice, we've talked about so much good stuff today.
I know so much.
If there was one thing that for us as parents we should know or we should do, what would that be?
Can I give 2?
Yeah,
of course. I'm going to give 2.
Yeah, of course.
The first one is, I would say, go with the recommendation from your dentist, and also feel free to, ask around to other parents too. When did you take your kiddo in? Did you know that you had to take your kiddo in? Because then you'll start to hear, oh yeah, that happened to me too. I had to bring my 7-year-old in. But I think just going and having those initial screening consults is so important, because you're fact finding at that point. So when that dentist tells you at 7, don't be scared. The orthodontist is really nice. That would be my first piece of advice, is get that kiddo in, let them feel comfortable with the orthodontist, have an early screening. That is a big ticket. The other important thing that I would say is, I think as parents, we carry a lot of our own past history with us into a medical appointment with our kiddos. And I would say, just know, as we've been talking about, orthodontics is very different than it was in the 80s. We tell people all the time, we actually our expanders are 3D printed metal now.
Wow.
That's like something I couldn't even think of when I was younger, right? And so it's such a different process. And so a lot of us come with this like, oh my gosh, I was in braces for 6 years, or I remember that pain, and I would say to parents, try to hold that piece back for yourself, and your kiddo's experience will be different. It's like a kinder, gentler world now, especially in orthodontics, and just allow them to find that journey on their own. Take your own, negative 80s experience out of it if you can.
There were a lot of negative. Let's go back to the hair for a moment.
Totally.
Yeah.
But that would be probably one of those important pieces that I would offer.
Dr. Meg, thank you so much. This was
so
awesome.
Glad to be here. Yeah.
I also want to mention we will have more resources on our website, wgme.com/raisingme. Dr. Meg.
Awesome.
Thank you.
Yeah, so great. Thank you.
I got to tell you, one of my very favorite parts of this conversation, which I just enjoyed overall, was the personal story that Dr. Meg shared about her parents, and that they had to pick only one of the kids to get ortho when they were growing up. And it was her. I'm really just grateful that she shared that. Ortho, it is expensive. I'm right in the thick of it right now with a second of 3 kids. And as she talked about, there are ways to work through that. And just a couple other, key takeaways overall, that these early screenings are important. I am telling you, I almost fell out of my chair when the dentist suggested taking our 6-year-old. 12-year-old is still currently in braces. Well, come to find out, it is not that outrageous at all. And now it does make more sense that it could very well be preventative, avoiding much more invasive treatments down the road. So, I don't know. So much has changed since the days when those bulky metal braces were the standard. There are so many other options to fit whatever's best for your child. And as Dr. Meg said, it is a much kinder, gentler experience. Thank you so much for listening to Raising Me. Thank you to our sponsor, Maine Health. I'm Adrienne Stein. This episode is edited by Megan Littlefield and produced with Nate Eldridge. Please follow Raising Me wherever you get your podcasts, and consider a positive rating and review so others can find this message. Wherever you are, I hope you learned something new and get to take a little time for you.